Tonight, the state has a new plan to try to get to the bottom of a troubling trend we've been reporting on here at Channel 9. A lot of families are concerned about this, medical experts concerned about this as well. And here are the latest numbers. 39% of the confirmed cases in North Carolina are among African Americans. And African Americans make up 38% of the deaths we've had in the state. Now, they only make up 21% of the state's population. Our Deshaun Brown joins us live tonight, and Deshaun, health leaders are taking a closer look all across the state at this and here in Charlotte as well.
Yeah, and Scott, their efforts are focused on getting very specific about how and where resources are allocated among a range of patients. And experts say that is important during the pandemic, but it will be after as well.
No two communities are impacted the same. Experts say that's been one of the glaring truths that's resurfaced during the COVID-19 pandemic.
The challenges that our historically excluded communities have been facing are not new based on COVID-19.
Dr. Jerome Williams Jr. serves on the Health Equity Council for Novant Health, where he and others work to research and improve access for historically excluded communities. In North Carolina right now, that includes African Americans, who make up 21% of the population, but 39% of positive cases.
We can't increase healthcare access by bringing access points to neighborhoods and expect health to improve if we still have challenges with food insecurity, if we still have challenges with affordable housing.
At Novant, leaders recently set up mobile clinics in Charlotte where the data shows residents are most at risk. The topic also at the center of a community conversation by the Harvey B. Gantt Center, where key voices included the Chief Diversity Officer for Atrium Health.
We have a heat map, if you will, of where the highest concentration of these COVID positive cases are, and we have mobilized these roving test sites to go where they are. And
at Atrium, leaders also launched a vulnerable population task force, specifically addressing a range of patients. That's everyone from the homeless to victims of domestic violence or sexual assault. In an email today, the task force leader referenced virtual platforms as one example to help make sure abuse victims don't lose access to care.
And I am also working to get more information, more detailed information on efforts on the state level. But I can tell you, just yesterday, the state announced they have now designated teams to help deal with the disparities among racial lines and also access to testing. Back to you.
Got to take a hard look at the numbers. Thank you, Deshaun, and hope to figure out exactly why that is.